Number 6 on your calendar, please. Representative Podium.
Thank you, members. This is going to be a bill that we actually looked at last year, but I'd like to get a motion in a second. Thank you. Members, we actually passed this bill on the House floor last year, and we have the original bill that we passed in the form. However, I have filed an amendment on the bill to try and address some of the issues that we'd actually looked at, and I'd like to take that amendment up first.
Motion on the amendment. Okay. The amendment number is 2948. 2948.
All right. In that amendment, on the last page, which would be page 7, everything else will be word for word up until that, the last paragraph. And it's going to start in Section 3 and Section 4 are the things that I've added on the amendment. Now, what we do with this bill is we simply want to go to Congress and ask if they would give permission for Tennessee to consider how we would handle health care here in the state by ourselves if we had our own program. It doesn't say we will. It doesn't say we won't. It just is going to ask Congress for permission if they would allow us to join 9 other states that have passed this to say we would like to look at how it might look for Tennessee alone. In the compact, when we would join this compact with 9 other states to date, and then as many other ones as would pass this, it says we are not bound to anything that the other states do or don't do. Tennessee has the only authority over Tennessee health care. So if another state wants to do something, they cannot bind Tennessee to anything. If Tennessee wants to adopt a policy of another state, they can, but we have no obligation to do that whatsoever. We're only asking Congress for permission to consider if Tennessee can run its own health care program better. That's simply what the bill does.
Thank you, Mr. Sponsor. We'll now open the floor for questions that may be coming from the committee. Representative Shepard.
Thank you, Mr. Chairman. I feel like I'm almost an expert in health care compact after 4 years of hearing about this bill, but it wasn't in this committee. It was in Health Committee. And I'm questioning why it's not in Health Committee again. And I'm not suggesting that this is a bad venue for it or a good venue for it, but I do believe there are members that have heard this in the last 4 years that probably could make a little bit better judgment on it maybe than people that have not heard it. Now, your changes are substantial, obviously, to the original bill that you said passed last year. I don't think it really passed. I think I don't know really what did it happen? What happened last year? I can't remember. I know it didn't become law, so what happened?
It passed in the House. Okay. The Senate had a different version.
Okay.
And it went to conference committee.
Okay.
And it did not, when it came out of conference committee, it died at that point.
Okay. So you've reconstructed the bill, or resurrected maybe the bill would be a good term. And I remember last year it had a $50,000 fiscal note.
That's correct.
And I noticed there's no fiscal note here. Is that because you've made this amendatory
change? Yes, I have in the 2 sections that were changed on page 7, that has been addressed.
Okay. And the money, I think, from last year, the $50,000 was for what? Do you remember? I don't. It was something to enable us to join the compact.
It was if we wanted to send a member from Tennessee to the compact wherever they would meet, they would have the finances to go down there and do whatever they need to do wherever the compact would meet.
Okay. Well, Mr. Chairman, I'm opposed to the bill personally, you know, and I've always wondered why we needed this. I do understand that we need to think outside the box. I think this is obviously thinking outside the box, and I'm not going to criticize that. But I'm a little disappointed that this was not referred to health, where actually it is been before, and it should be. I'm not going to make a motion to send it to health because I think I'd lose that motion, but I just want to make a comment for the record. I think this bill should be in health committee where it has been vetted and discussed, and the people there are have been educated about the compact. Thank you, Mr. Chairman.
Thank you. Any further questions? Yes, Representative Flowers.
Thank you, Mr. Chairman. I concur with my colleague, Dr. Shepard. I really don't understand why this bill has been brought to this committee, especially this being a new committee also. And there are members of the Health Committee who have the history of this bill. This is not something that you would do just on a whim. It does require a lot of scrutiny. We have had Medicare in existence and Medicaid in existence since 1965. And I certainly was here when it was first introduced and first implemented. And I do know what has happened through the years to make it work. And I do not understand why our state would implement this bill, enact this bill, not really having the expertise that the federal government has. Medicare has been demonstrated to work effectively. And we would be asking, if we join this compact, we would be asking for federal funds to be given to the state of Tennessee, just as federal funds are given to the state of Tennessee for our TennCare program, which is still an experiment. Why do we feel that we would be able to do a better job of implementing our Medicare program? Could we assure all people who are eligible that they would be able to be covered with Medicare? This is too complex, Representative. I admire you for what you are making efforts to try to do. But I think that this is something that really deserves much more scrutiny. And it was obvious that many people shared my sentiments. Otherwise, the bill would have passed last time. Thank you.
Thank you. Any further questions of the committee? We are then to vote on the amendment to the bill first. Those in favor of the amendment speak aye. Aye. Those opposed vote nay. Amendment passes. Now we're back on the bill as presented. Those in favor of the bill as presented would speak aye. Aye. As amended. Those opposed vote nay. Bill passes from the subcommittee.